Parents, let me ask you this. What would you do if your child suddenly would just faint, that they would just collapse, that they would lose their breath? Well, I walked into the exam room and both their parents were sitting there, and I knew, okay, this isn't just the regular office visit, chiropractic adjustment that she normally receives. So today we're going to talk about a condition called dysautonomia or POTS, postural orthostatic tachycardia syndrome. This patient's a sophomore in high school. She's an athlete. She runs track. She does cheerleading, and she does basketball as well. Okay, so let's go back to the COVID years. And she's diagnosed with COVID, and it takes her a long time to get over it. Then she sees me just for routine musculoskeletal bumps and bruises that an athlete in high school would get. So she comes in, and I'm looking at her, and I'm just thinking this is going to be a routine office visit. But once again, I see the parents, and they have a concerned look on their face. And so they tell me, and I don't know why it took so long, because I really don't remember in the history, and I went back and looked in my records, they failed to mention that she had COVID and that it took a long time for her to get over it. She's been diagnosed with long COVID symptoms. And as a result, she also has dysautonomia or POTS. And this was diagnosed by specialists down in the Grand Rapids, Michigan area. I didn't know any of this. Okay, I didn't even think to ask. That's just not a normal question you ask on a history. I may have some chiropractors out there that'll disagree, or some PTs or some medical doctors. But anyway, never was brought to my attention till last Thursday. So I said, what's going on? 6 weeks ago, she had a concussion. She was cheerleading, and they didn't catch her. And she fell and hit her head on the ground and was momentarily dazed and felt fatigue, had a headache, balance issues, brain fog, difficulty in concentrating, eye issues, sensitivity to light, you name it, okay? Classic concussion symptoms. And I'm thinking, when they're telling me this, I wonder why they didn't bring her up to me, because I treat more concussions, sports-related concussions, than probably anybody in northern Michigan, and I have been for quite a long time. At any rate, I let it go, and I said, what brings you in today? Her POTS, or dysautonomia, has gotten worse. That's where I went, POTS, dysautonomia? When did this all come in? That's when they told me the story. So evidently, on the last football game, she was on the sidelines as a cheerleader, did some whatever moves or whatever. Next thing she knows, she's waking up on the sideline. She had passed out, and her parents came down out of the stands, and they weren't concerned because this has become a normal occurrence. At least 2 to 3 times a week, she passes out. Now she's passing out after basketball practice, or sometimes during practice and the coaches all know, and they just sit her up and monitor her. Evidently, at track, she's a hurdler, and her coach would wait at the finish line after every race, and she would collapse and faint and be out for a little bit. And now they're getting concerned because since the concussion, the occurrences are happening more frequently. So they finally bring her up. They bring her up because they had also been released from the specialist down in Grand Rapids with the instructions, watch her sodium intake and make sure she's properly hydrated. Anyway, at least they came up. I did a full neurological examination on her, and we started with brain tap HRV, heart rate variability, which is going to tell me how her autonomic nervous system is functioning. That is dysautonomia. See, our autonomic nervous system, we have 2 parts. We have the sympathetic, which is the gas pedal. That's when you're out in the woods and you come across a bear, you're going to fight or flight. Or if you just had a near miss for a car accident, city driving, heart rate goes up, respiratory rate, that's a sympathetic overload at that time. But then your parasympathetics kick in and you're brought back down. Dysautonomia means your sympathetic overload and your parasympathetics are not kicking in. And this can lead to sleep deprivation. It can lead to anxiety. It can lead to depression. This kid, and she is one of my favorite patients. She always comes in real bubbly, smile, just a beautiful sophomore in high school. And it wasn't the same girl that I've known since 7th grade. She's worried. And I asked her that. I said, are you worried that you're never going to be the same? She said, Yes, I am. It's really starting to scare me. I looked her in the eye and I said, you will not have to live this way. I promise you, you will not have to live this way. Now, I know you're thinking, oh man, that's a bold promise. Here's why I can say that. Because I have dealt with dysautonomia and POTS many times in treating sports-related concussions. They may have come in with presenting with that. And here's one of the biggest features. When they're laying on my chiropractic adjustment table, I put a little device on their finger called a pulse oximeter, and it will tell me their heart rate. When they are in dysautonomia, they're just laying there. There's no stress or anything happening, but these student athletes will have a heightened or increased heart rate into the 80s, and that shouldn't be. So when I put her onto the table, laying face down, and again, did the pulse oximeter, and it zoomed up to 85. No way. This is an athletic built, just really good shape 16-year-old girl. There's no way that it should be that way. So I did the manipulation, the Cox flexion distraction technique, and I did it on the cervical spine, and I had the pulse oximeter still on. It's the way I can tell how I'm affecting a patient's nervous system. It's really pretty cool. But the Cox technique was just very gentle. It's like a stretching technique. And I was sitting there watching, and it went down, finally got down to 58, right where she should be. And after that, we put her into brain tap entrainment therapy. There's a headset, and we had her listen to the concussion series. There's 30 sessions. We started her on session 1, and we put her into Normatec compression therapy. So I did a research study in conjunction with brain tap on the residuals 2-year follow-up with kids that had a sports-related concussion and received brain tap and Normatec versus those kids that I treated before I had those therapies to see what the outcomes were. The kids that had the brain tap and Normatec by far had much better resolution of their symptoms. Matter of fact, it was so statistically significant that we are going to expand that study. So what I'm going to do for this patient is I'm going to add another dimension to it. I use a neurological muscle stimulation unit. It's a direct current unit, and we're going to do what we call the master reset. And this is where we'll put pads on her neck and then 2 pads on the bottom of her feet. And we're going to bump up that vagus nerve. The vagus nerve is the primary parasympathetic nerve, and it's not functioning. So we're going to bump that up. She'll still do brain tap. She'll do Normatec, but we'll include the master reset during those sessions. She's going to be so relaxed, and we're going to get that pulse rate to be down. More importantly, we're going to get her from fainting and passing out all the time. She'll still get the Cox flexion distraction, easy adjustments, and I'm going to see her for about 8 visits, and then we'll do another reeval and see how she's doing. So I'll keep you informed how we're progressing with her. But parents, isn't that scary? So if you're out there and you know of this, if you've had somebody that you love or a friend or family member that's been diagnosed with POTS or dysautonomia, and somebody's recommended either just manipulations, that's not going to do it. That's a good start, but that's not going to do it. If they're recommending dietary change, that's okay. But we have come up with a what I call multi-layering of neurological treatments, and we've been very successful. Send me a comment, please, if this has happened to you or if you're stuck and you don't know where to go. Subscribe, obviously. Please. We just hit 201 subscriptions. Let's boost that, man. That's the only way that we can defeat pain. In this case, we're going to start defeating suffering too. So like it, subscribe to it, and hit me with questions and comments. I'll check on you later in the Defeating Pain podcast.